Welcome back. Today we'll be covering vitamins. So vitamins are non-caloric organic nutrients, and they help the nutrients be digested, absorbed and metabolized or built into the body structure, such as coenzymes for the amino acids, and they cannot cure any disease except a deficiency, and that's really important. The NBME and the STEP exams like to trick people with this, but remember, vitamins can't cure any disease. So let's go through the differences between a fat-soluble and a water-soluble vitamin. So the fat solubles are hydrophobic, and they absorb first in the lymph, and then it is transported into the blood. They require the protein carriers because they're hydrophobic, and they will be stored in the cells associated with fat. They're less readily excreted, and they tend to remain in the fat storage sites, such as the adipocyte. And they are the ones that we need to watch out for, because they are the ones that are likely to reach toxic levels, and they're only really needed in periodic doses for the average healthy person. Water-soluble vitamins are the ones that absorb directly in the blood, and they travel freely. They circulate freely, so they really aren't stored anywhere, and they're excreted by the kidneys through the urine, and it's possible to reach toxic levels, but it's very rare due to the ability to be removed by the kidneys. These you can take daily, and I like to remember the fat-soluble vitamins as just ADEK, so ADEK. Vitamin D, C are deficient in breast milk, while vitamin K is absent altogether. Riboflavin, B2, is photosensitive, and water-soluble vitamins can be washed out or cooked out of the food. And like I said before, water-soluble vitamins are easily excreted. So vitamin C, remember when we went through scurvy, so a deficiency will cause scurvy, and a deficiency of vitamin C will affect collagen production because it's an enzyme of prolohydroxylase and lysyl hydroxylase. It also is antioxidants that protects us from the free radicals that are made when the immune system is active. Remember, immune system produces peroxidases, which produce hydrogen peroxide to degrade pathogens and unwanted materials. So the symptoms of scurvy and vitamin C deficiency is the loss of appetite, gross cessation. So there's going to be deformed limb in children, the bleeding gums because of the fragile capillaries, swollen ankles and wrists, weakness, anemia, and red spots on the skin, also known as petechiae, and loose teeth, once again due to the collagen abnormalities. So the toxicities involve the alteration of the insulin response to carbohydrate, and it interferes with blood clotting. It can cause kidney stones, gout, and digestive problems. So vitamin B they don't really work by themselves. They have to work concurrently with enzymes as coenzymes, and they play a large role in metabolism, where they release energy in order to help synthesize the proteins. And in the deficiency of any of the B vitamins, every single cell is affected. So thiamin is B1, and it has a role in energy metabolism. It's found on the nerve cell membranes, and nervous tissue and muscles depend on thiamin, and it's metabolism is related to fatty acid synthesis. So in beriberi, it's a disease where is a genetic disease where the afflicted patient can't use fatty acid for energy. So there's two different kinds: wet, which affects the heart and the circulation, and dry, which affects the nerves. And look here, so these are the symptoms. There is confusion, emaciation, inability to speak, great weakness, wrist drop, and loss of the deep tendon reflexes. There's pain, there's foot drop, there's burnings, tingling sensation, and numbness of feet. That is because of the nerves that are affected. So Wernicke-Korsakoff syndrome is caused by chronic alcohol abuse, and the alcohol abuse prevents the bodies from absorbing thiamin, and the symptoms are apathy, irritability, altered mental status, and jerky movements. Wernicke-Korsakoff can be treated partially by prescribing thiamin supplements for the patient, and I say partially because it depends on how fast you catch it, and by the time you do catch it and the symptoms appear, quite a bit of damage has happened. So there's going to be cirrhotic liver and some encephalopathy that's already happened. But if you have caught it early, you can prevent further degeneration. But once the encephalopathy has occurred, you cannot return the patient back to full mental health, because the neurons do not regenerate. So riboflavin is vitamin B2, and it plays a role again in metabolism, and it's made from the amino acid tryptophan. It's a FMN and FAD molecule, and it works in electron transferring, and in a deficiency it manifests as dermatitis or chiliosis. Chiliosis is these wounds, essentially, at the corners of the mouth. This is a little bit rare here in the States. Niacin is vitamin B3, and it plays a role in fatty acid energy metabolism. This one is a coenzyme for NADPH, as an electron transferring molecule. And in a deficiency, in developing countries, it manifests as pellagra, which is, as you can see, caused by poverty and generally alcohol addiction. It's characterized by the 4 Ds: diarrhea, dermatitis, dementia, and death. Niacin as a medication is used to lower blood lipid, and which is associated with cardiovascular disease. It's found in these foods. And toxicity, it can cause a life-threatening drop in blood pressure, liver injury, peptic ulcers, visual loss, and a niacin flush. Remember the glutamate sensitivity in Chinese restaurant syndrome? That is similar to the niacin flush. Like, you two have the same symptoms, such as palpitations, flushing of the face, feeling very warm. So folate is vitamin B9, and it is involved in the synthesis of methionine, purines, thymidine, and is important for making new cells and breaking down complex carbohydrates for energy. It works by transferring 1 carbon units. And in a deficiency, there is a megaloblastic anemia, diminished immunity, abnormal digestive function, and in utero, a mother who is deficient in folate can produce a child with spina bifida. Spina bifida is when the spinal cord does not close completely, and when the child is born, there is an opening in the back and the vertebra, and the spinal cord can herniate out. Here is megaloblastic anemia. It's characterized by these enlarged cells. Look here. And these enlarged cells are generally the white blood cells, leukocytes, neutrophils. This in particular is a neutrophil, but it can affect those other white blood cells, and it's an anemic condition because the body will recognize that these cells are abnormal and they will degrade and remove them. So by degrading and removing the white blood cells, it causes the immunity dysfunction and the anemia. So a risk of folate can increase, like, cervical cancer once the patient has been exposed to HPV, the human papillovirus, and pancreatic cancers because of smoking. So sorry, I can never pronounce this. Cobalamin is vitamin B12, and this works in conjunction with vitamin B9, which is folate, and it's present as methylcobalamin and deoxycobalamin in the body. These play a role in maintaining the nerves, and they play a role in blood cell synthesis. And the symptoms of deficiency can include the production of immature red blood cells, and the immature blood cells can cause anemia because they're not able to be fully saturated with hemoglobin. Treating a B12 deficiency is very tricky because you can treat the symptoms but not really treat the cause. If you're not very careful in blood work, or the patient seems like, too healthy, they just complain of lethargy. So if you just give them B9, it can hide the B12 deficiency. B12 deficiency is involved in pernicious anemia. We'll describe that in the next slide. And the deficiency cause damage to the nerves, which is creeping paralysis and muscle malfunctioning. There isn't really such thing as a vitamin B12 toxicity. I mean, it exists, but it's just very, very rare. So the intrinsic factor is made by the stomach for the absorption of B12, and for some people with either genetic dysfunction in the production of intrinsic factor, or vegans in particular who don't eat enough of certain foods that contain B12, which is unfortunately in meat, they have pernicious anemia, which is caused by the lack of the intrinsic factor. So in order to treat it, you have to administer it by IV to bypass the defective absorptive system. So if you give a patient with a pernicious anemia like either IF or B12 orally, they're just going to excrete it. So pyridoxine is vitamin B6, and it converts one amino acid to another in transamination. This is the most common one, tryptophan to vitamin B3, which is niacin. And it also plays a role in the synthesis of hemoglobin and the neurotransmitters, such as dopamine, serotonin. Because remember, when we went through the amino acids, those catecholamine neurotransmitters were made by tryptophan. And it releases glucose from glycogen, and it plays a role in immune function and steroid hormone activity. It's critical to fetal nervous system development, and the deficiency is characterized by microcytic anemia, depression, and convulsions. Toxicity is fatigue, impaired memory, nerve damage, and skin lesions. So biotin is B7, and pantothenic acid is B5, and those are rarely deficient, and they're important in energy metabolism. Biotin is involved in carboxylation reactions, which binds it to the enzyme, and once again, it's a coenzyme for energy metabolism and particularly fat synthesis. And pantothenic acid is used to make the coenzyme A, which functions as the acyl carrier in, remember, Krebs cycle. So the non-B vitamins are choline, fetal development, and carnitine, inositol, and lipoic acids. Those are non-essential, which means the body can synthesize these by itself, de novo. So unfortunately, L-carnitine isn't super useful, I'm sorry to say, for people who want to bulk up using these protein supplements. In order to really bulk up, you have to just, increase the amount of protein, especially good proteins, lean proteins, needed, and work out consistently. And if you truly need a supplement, don't use L-carnitine. You really should be using the BCAAs instead. So the fat-soluble vitamins, remember, A, D, E, K. Those are found in fats and the oils of various foods. They require bile for absorption. The bile will emulsify it in order for our intestines to process them, and they're stored in the liver and the fatty tissue until needed. These are the ones that you don't need daily, and they are very low in people who are vegans or vegetarians. So those people with those dietary restrictions need to be careful about this. You can see they play a variety of roles. We'll go through them, starting with vitamin A. So vitamin A, its precursor is beta-carotene in plants, and its retinol is its active form, and that is stored in the liver. They're found in these colorful fruits and vegetables, and the liver will convert beta-carotene and the other precursors into retinol and retinoic acid. And these are particularly important because they play a role in gene expression, vision, maintenance of the body lining, reproduction, immune systems, growth, cell development. But their main function is maintaining all of this by regulating genes. That's why people who are taking vitamin A, retinol, are recommended not to take it when they are planning to be pregnant or they are pregnant. This applies to both women and men. Vitamin A is quite good for epidermal resynthesis and resurfacing. That's why it's sold over the counter and by prescription for cosmetics reasons really. That, even though it's applied topically, can still affect the genes, and that can be teratogenic. Same goes for men. For ladies, of course, it will affect the fetus, but for men, it can play a role in affecting the genes that regulate spermatogenesis. Right, so vitamin A is also used to process light perception and maintain a healthy cornea. Vitamin A is a part of rhodopsin, and when activated, it breaks off and initiates a signal that conveys the sensation of sight to the optic center. Deficiency will cause night blindness, and night blindness is the lag before the eye can see again after a flash of light at night. You know how, for the average person, it takes a couple seconds and whatnot, right? So for people who suffer from night blindness, it takes minutes. And that is quite a big difference, especially if you're trying to drive. So in very, very deficient cases, the keratin can accumulate, and that clouds the eye and leads to cirrhosis, which is the drying of the eye, and it thickens the cornea because of the keratin accumulation, which causes blindness, and it can also cause xerophthalmia. And this all happens because the vitamin A is responsible for secreting some mucus to maintain the osmotic balance in the eye. And this is all affected by the retinol binding protein too. So the keratinization of the skin the body fails to make mucus and secrete keratin instead due to the vitamin A deficiency. This causes the patient to be susceptible to infection. And vitamin A also works with the immune system and help in the growth of bone and teeth. And it's also proven, really, that having carrots often is good for eyesight. I never believed it as a kid, but now that I actually studied this, apparently it's true. I regret it now since I wear glasses. But low beta carotene is correlated to a high incidence of macular degeneration, and it works as an antioxidant as well. So vitamin D is cholecalciferol or ergocalciferol, and you can, us as the people, we can synthesize it with sunlight. It undergoes a transformation in the liver and the kidneys, and it's used to regulate blood calcium and phosphorus level, and it raises the blood calcium in the skeleton, the digestive tract, and the kidneys, and it works opposite of the parathyroid hormone. So the vitamin D will put the calcium and phosphorus down, and parathyroid will stimulate the osteoclast to break down the bone and remove the calcium. So vitamin D stimulates the maturation of cells, and they act on the genes because remember that vitamin D is a fat-soluble enzyme, or fat-soluble vitamin, and since it is fat-soluble, it can work as a hormone. So that also affects how cells grow and multiply and specialize. A deficiency will cause hypertension, some common cancers, rheumatoid arthritis, multiple sclerosis, and psoriasis. Here are the main, the diseases that are affected by vitamin D. And toxicity will affect the bones, the kidneys, the brains, the heart, and nerves and arteries. Alright, so this is how it is synthesized in the body. UV light from the sun will activate the cholesterol in the skin and transforms it into the 7-dehydrocholesterol. That is, transported to the liver and kidneys, and those convert the precursor to calcitriol. And then calcitriol is used to stimulate, bone growth and calcium deposition. Sunlight will break down the excess vitamin D, and that is why there's no toxicity. Deficiency can happen, particularly in people who are pale skin, because people with more melanin, they need more sunlight in order to convert, and light-skinned people need only about 10 to 15 minutes, but they do generally live in places that are very cloudy. So people who live in, let's say, the Pacific Northwest of the Americas, or Canada, or very, very far north, and these people do need to either supplement with vitamin D or go into a tanning bed. So tocopherol is vitamin E. It plays a role in antioxidants, and there is no toxicity that's really associated with it. A lot of the U.S. population is actually deficient in tocopherol because it's found in oils, sunflower oil, olive oil, sesame oil, all those oils. And you might be thinking hey, us American citizens, we eat quite a bit of oils. Look at all these fast foods. But whenever we cook and deep fry these oils, all of the healthy benefits are in the oils are converted into more harmful either hydrogenated oils, or the conformation has been changed into trans fats. So here's the dilemma. Should we take supplements? There are two arguments for them, but definitively I can say that if you are vegetarian or you are vegan, you need to be taking supplements, especially if you are vegan. You need to be taking B12 supplements. There are just some the vitamins that you cannot have from plants. People who live in abject poverty, they need vitamin supplementation in their foods. I'm not saying just give them just plain old vitamins, because that is expensive, and vitamins don't work by themselves. You cannot just take vitamins and survive. You need vitamins to be eaten with food. The best time to take a vitamin actually is around like lunchtime, and either like right before lunch or right after lunch, so your body can process the food and absorb the vitamins at the same time. And then people with some congenital or gene defects, the ones, if you can recall, with like some deficiencies in the enzymes that absorb these vitamins, they just need to take higher doses in order for some of the vitamins to be absorbed, because their body isn't able to process these vitamins well. Most of the time, anybody who is taking supplements regularly, we are overdosing ourselves, because if you see the labels, they're generally like vitamin D is 100%, or vitamin C is 300%. We don't need that many percentages in a day, because you're not just eating the vitamins, you're also eating food, and food does have vitamins. We do not need that many. These are like low dose, important, molecules, but they're low doses. You really need to be eating, healthy foods instead. A vitamin can't cheat you out of a good diet. Like, you can't use it as a shortcut in order to maintain decent health. So if there are people who really desire to take vitamins, either because they're in college and they have a somewhat poor diet, or they live in a very busy lifestyle and they don't often eat home-cooked meals or have regular fruit, I would recommend having vitamins just like once a week instead of every day, because the vitamins are generally multivitamins, so they have both fat and water-soluble vitamins. Since water-soluble vitamins you can take every day, fat-soluble, remember, you can't, because it causes a lot of complications. These are the ones that can cause toxicity symptoms. Okay, that's it for now. Thank you for your attention, and choose wisely whether you want to take vitamins or not.